The Woff-Parkinson-White Syndrome is a type of ventricular pre-excitation syndrome. The term pre-excitation comes from the fact that there is an accessory pathway called the bundle of Kent that enables the electrical current to bypass the AV node, leading to earlier or pre-excitation of the ventricles. So we can see here there's this accessory conduction pathway that exists called the bundle of Kent generally. This enables the electrical current beginning at the sinoatrial node to bypass the AV node, which causes a earlier excitation of the ventricle. Remember, the AV node is where the electrical impulse slows down because there are these slow inward calcium channels that essentially cause this inherent pause as the PR interval, or gives time for the blood to flow from the atrium to the ventricle. So when you do not have the AV node, or when the electrical activity bypasses the AV node, we see a pre-excitation of the ventricle. And this is going to be seen in our EKG as a shortened PR interval. We can see here the PR interval is shortened because of the presence of this delta wave. And the delta wave is showing us the electrical activity of this accessory pathway. So in addition to having a shortened PR interval, we actually see the QRS interval elongated. So our EKG machine, which picks up and gives us times or elapsed times of our PR and QRS interval, may show that the QRS interval is prolonged and the PR interval is shortened. Remember, the PR interval is generally between 120 and 210 milliseconds, or 200 milliseconds, to make it easier, while the QRS interval is less than 120 milliseconds in a normal functioning heart. So in this case, we would see a PR interval less than 120 and a QRS interval greater than 120. This should make you start to think about a Woff-Parkinson-White type syndrome.